Hello, today I'm going to explain the influence of diabetes on periodontium. Basically, there are two types of diabetes, the type 1 and the type 2. Here in type 1, the pancreas fails to produce insulin. In type 2, the insulin is produced, but the insulin receptor fails to respond to the insulin. So the glucose still remains outside or extracellular. So basically, diabetes is a metabolic disease characterized by hypofunction of B cells of the islets of Langerhans in pancreas. This leads to an insulin lag, plus high blood glucose level, plus excretion of glucose in urine. The oral manifestations in uncontrolled, poorly controlled diabetes are we have a first diminished salivary flow, xerostomia, also called xerostomia, which leads to burning mouth or tongues, infection by opportunistic microorganisms such as Candida albicans, leading to candidiasis. We have plaque accumulation on teeth, increased incidence of dental caries plus periodontal disease, loss of attachment and tooth mobility, and ketone smell. The factors which contribute to the development of periodontal disease are the increased glucose content in the gingival fluid, which will increase in the pathogenic microorganisms. We have the thickening of basement membrane of blood vessel walls, which narrows the lumen, and which is also called microangiopathies. We have an altered immune response, which means we have impaired chemotaxis and phagocytosis by neutrophils. The neutrophils are the first defense or the primary immune response when we have the innate and the acquired immune response. So these are one of the first neutrophils which come to respond. And this one, when we have an impaired chemotaxis, it lowers the host response. Second one, we have the increased production of pro-inflammatory cytokines. We have the interleukin 1 and 6 and tumor necrosing factor, which leads to bone resorption. Then fourth, we have the altered collagen metabolism, which increases the collagenase activity. The bacterial associations. In type 1 diabetes, we have the Capnocytophagia species and the A. actinomycetum comitans. In type 2, we have the Prevotella intermedia, or P. intermedia, P. gingivalis, and Campylobacter rectus. The treatment. To sum up the treatment, the extensive periodontal treatment in patients with uncontrolled diabetes is contraindicated. But we give antibiotics such as penicillin, tetracycline, as doxycycline, due to its anti-collagenase activity. So this is it, the influence of diabetes on periodontium. I hope you understood everything. If you have any question, then you could write in the comments below, and I will answer any questions. Thank you.